Hey everybody, Dr. Mark here. Thank you for tuning in on another one of our wonderful conversations. I am joined today by Dr. Robert Affolter, and great guy. I've known him for many years. Dr. Robert, tell us where you graduated from and how long you've been in practice.
Well, my history goes a little bit beyond practice. I was born in Davenport, Iowa, while my dad was attending Palmer School of Chiropractic. Actually, Reggie Gold was president of his graduating class.
It's
So I've
awesome.
actually been in chiropractic all my life. I graduated from Palmer after my undergrad was in chemistry, and I got an MBA before I attended Palmer College. So I was graduated from Palmer College of Chiropractic in 1984.
That's awesome. That's awesome. And where are you practicing now?
I'm not practicing now. I'm retired.
That's amazing.
So I'm
So,
doing education,
education, and where are you teaching at?
just online,
That's awesome.
online seminars.
That's amazing. So you have your own online courses?
I'm redoing them. I had them through ChiroCredit. I had a philosophy series through ChiroCredit, and right now I stopped it in 2021,
Yes,
and
sir.
I realized that they really need to be upgraded to videos. A lot of it was text, and I started out with philosophy doing logical fallacies, informal fallacies. I thought we really needed to start with that because so many of us don't understand that we're thinking wrong. And until we've really approached philosophy, we don't catch our errors. So I started there and then I went through Didi's book and I spent, I don't know, maybe I had 12 hours, 13 hours of continuing education at that time. But I really feel like the technology's advanced to the point I started doing that in 2004, and the technology's gotten to the point that I need to do something different and improve it. So I just haven't quite gotten back to it. In fact, I've just now got my studio going.
No,
So
that's great. And that's
I
great. And we get to
get
see it
started.
here, and it looks fantastic. It looks
Good,
great, Robert.
good, thanks.
It really does. It really does. And we're going to go. I'm excited. Maybe we will have a debate. The past of my have been conversations. I haven't really had any debate yet, but maybe we will,
Okay,
the
we
the
can run this however you want to do it.
yeah, bro. I'll go ahead and state where we're going,
Okay,
and then we'll let it ride, and we'll have a nice, wonderful 30-minute conversation. So, um, what we're going to start with, and we've talked online, and a statement that you had made was the non-therapeutic model of chiropractic is nonsense. So what I'll do is I will state how we define chiropractic in the NTC model, NTC standing for non-therapeutic chiropractic.
okay,
And then we will go from there and see how things roll. So
okay,
the NTC chiropractic defines itself that chiropractic is the analysis and the facilitation of the adjustment of vertebral subluxations because they, in and of themselves, are detrimental to the expression of innate impulses. Chiropractic is all education toward this objective. Chiropractic is nothing else. So that's going to be the definition. We can modify it because we can also add, if we go deeper, we can say that innate impulses, educated impulses, innate waves, special sense cycle, that any one of these things could be interfered with because of a vertebral subluxation. In short, that the vertebral subluxation, the chiropractic entity, is a very bad thing, and that the adjustment of vertebral subluxations to their innate normal position is always good, always powerful, and always brings the body closer to its full potential. So that's where we're starting at with the premise. My side is to defend that definition or improve it. So please, Doc, go ahead.
well, I think we've got to start with some definitions of your terms. So how
Yes,
do you
sir.
want to define innate?
Well, we look at innate as a law, as a principle that we're innate. Our understanding has evolved past DD, BJ, and Stevenson. That this innate law is not the soul. It is not a personification. Not to say that those things aren't present, they're not chiropractic entities. That, like the law of gravity, like the law of inertia, there is a universal principle of organization that extends into living matter that we call the innate law of living things. That particular uh, um, that its function is to coordinate, control the living matter that it resides in, so long as that matter is alive.
So are you equating that with life?
That would be a part of life. Yes, absolutely. That would be what emanates a living creature. Yes.
And what would your definition of health be?
Health, my definition would be not a chiropractic entity, and health could be many different things. If we look how it's defined on Google as the absence of disease, symptoms, conditions, and also a well-being of, mental, spiritual, and physical, very much all over the place. I would say the actual term of health would be outside the, though it can be impacted by chiropractic, health is not as much a chiropractic entity because it's so much in the medical realm. And with that being said, caveat, we do have two separate, distinct models in chiropractic. And the therapeutic model of chiropractic would fall under the definition of physical medicine, which would include any type of medical conditions, including health.
So one of the problems I have with it is we've missed what I consider to be the Palmer idea of what non-therapeutic chiropractic really was. And that was just correction of vertebral subluxation for the restoration of health. And health was defined, my favorite definition is Dorland's medical dictionary definition, which was optimal physical, mental, and social well-being, and not merely the absence of disease or infirmity. And what I like about that is optimal implies that there's something making a decision. What is optimal? I mean, it's going to change for every second of the day, depending on what stressors I'm under, right? So optimal really leads us into something making a decision. And if something's making a decision, we hope it's an intelligent decision. So I go back to really the regular Palmer idea of there is an intelligence controlling our lives, and that is probably pretty close to being our soul. And I'm not sure what the difference is between, you said there's such a thing as a soul and it's separate from chiropractic. I'm not sure how that works. So if you want to explain that a little more, that'd be great.
Sure, I'd be glad to.
Yeah, I'm going to maintain, I think, that soul is pretty close to an innate intelligence.
Well, if we look at the classic definition, I would totally disagree with that because DD and BJ, and maybe BJ got close to the NTC model when he was defending chiropractors in the 20s, and maybe BJ's utopia got close to it, but neither BJ nor DD ever left getting sick people well and treating disease. Both of them use dis-ease and dis-hyphenated ease interchangeably. And we've evolved. Do what?
Go ahead and expand on that a little bit.
Okay.
You're going back to the 20s, and I'm going up to the 50s. I've heard you state that Reggie Gold came up with something different, and I don't think he did. So I guess, yeah. I need that.
He did. But first, to define your answer, when we look at soul, the innate law doesn't talk to us. It's a principle of organization, and the innate principle is more complex in more complex living structure, as compared to an amoeba or a tree. Maybe they have souls, but they definitely have an innate law of living things. Could the soul talk to you? Yes, as a Christian, I do believe so. Is that a chiropractic entity? No. BJ and DD were both big into theosophy, mixing into chiropractic theological attributes and qualities, personifying universal intelligence as God and innate intelligence as the soul. And this made chiropractic a theosophy. which, history has been a bit critical on that, and rightfully so. The innate law does not talk to us. And I'm not saying you can't have a spiritual guide or intuition. You certainly can. They are simply different than the innate law. And within that, there is certain predictable things that, for example, the law of gravity always goes down. The law of thermodynamics has certain predictable qualities to them. And within the human body, there can be many different things if we talk about the human body. There can be this innate law that's going to coordinate function to maintain this living system alive until it's dead. And then we can also have other entities like a soul that we have this conscious awareness, and all of these things that we can acknowledge and simply say that as great as that is, it's simply not a chiropractic entity. And this is where, maybe intentional or not intentional, but Stevenson was brilliant in stopping the 33 principles with the a priori statement of, and as we modify it, a universal principle of organization that exists, that continually gives matter its property and actions, thus maintaining it in existence, and then deduct 32 other principles from there, starting from the big, most a priori statement, working our way down. Now, BJ never left getting sick people well. He may have come close. He did say things like the longest chiropractic
hasn't left that either.
In general, it hasn't. That's correct, Doc.
In fact, the law, you're in Mississippi, right?
Yes, sir.
Yeah. So your
Yes,
law
sir.
in Mississippi says that you're treating people.
A chiropractor.
Huh?
Yeah. It says I'm a chiropractor. You see,
well,
and
it says that if you're a chiropractor, you're taking care of people to make them more healthy.
Well, and here's where we can go with that, because when we have to understand what is arguable. And any state law, and before we get there, let's go back to what we were saying about Reggie. BJ Palmer never left getting sick people well, which is a medical objective. And in that medical
objective.
Okay, but let's further it down, because as our understanding grows and as words change, BJ did a horrible thing in 1961, Doc. He died. And to say that chiropractic stopped evolving in 1961 is ridiculous. I believe it was 19. Yes, totally. And I believe it was 51 when Stevenson died, in 1913 when D.D. Palmer died. So we stand on their shoulders, and Mabel Palmer and Marianne Pruitt. And with that being said, Reggie noticed that, you know what? He was in practice, and not everybody got well when vertebral subluxations were adjusted, and not everybody stayed well. In fact, the concept of that is a bit ridiculous, that there are so many variables that can contribute to a person's overall well-being, the vertebral subluxation being one of them. BJ
so that was not Reggie's discovery.
It definitely was. But let me finish.
You're saying he was the first.
He was the first to put things in an organized philosophical understanding. And I'm guessing your dad graduated with Reggie at the end of the 50s, right?
57.
57. And of course, there was your dad, Reggie, Joe Felicia, Sid Williams. Yep. Pretty powerful class. By the mid 60s, Reggie was beginning to work toward everybody lives better without vertebral subluxations, and for no other reason.
Now, what proof do you have that BJ did not feel the same way?
Well, it's not about feelings. It's about what he written. I didn't talk to BJ. He died before I was born. And what BJ wrote was chiropractic, getting sick people well and keeping the well from getting sick, up until his last book, which is our masterpiece. And that's what he wrote, The Sacred Trust. That's that excerpt before he died in 61 that specifically says getting sick people well and keeping the well from getting sick.
All right. How do you keep the well from getting sick?
I have no idea. It's not a chiropractic entity. Nobody is, there is no cure-all, Doc. And if we're going to reach the world.
Organizational principle.
I'm sorry?
Where does your organizational principle come in?
The organizational principle of the innate law, innate law of living things, it comes in because that's the coordinating principle of any living tissue. of any living piece of matter. Let's just say human beings we'll talk about. And vertebral subluxations interfere with the expression of this innate law. Is it the only thing that can interfere with the expression? No, it's not. Is it the only thing people need to live closer to their full potential? No, it is not. You stop breathing, you stop eating, you stop sleeping, you're probably going to have some problems. If you're underwater for a few days, you're probably going to have some problems. So saying that vertebral subluxations are the only is the only thing contributing to a sick person is one, is ridiculous, and two, is the practice of medicine. But if we, as chiropractors, could say, look, these vertebral subluxations in some way have misaligned, occluded the foramen, interfered with the nerve tissue, and that's interfering with the expression of the innate law, and that is a bad thing for everybody. You cannot fail them. They have no clinical presentation, and everybody lives better without them, is a really simple, logical case that we can say, hey, that makes sense. So let's have sound analysis in finding vertebral subluxations and helping this body, this innate law, adjust this limitation of matter back to its innate normal position. And Reggie was the first to come up with this. That is written down. Could there have been other chiropractors doing it? Possibly so. None of them wrote it down. None of them went to the extent that Reggie did in creating this different understanding and model of chiropractic that led to Joe Strauss, Claude Lessard, myself, bringing it further.
So I'm still trying to understand what you think you've enhanced.
The understanding of chiropractic and that it can be utilized by every man, woman, and child, not as a treatment of symptoms or conditions, not as a way of better health, but no, hear me out. That vertebral subluxations are always bad, and that the practice of getting sick people well is physical medicine. And if we are going to remain separate and distinct, as BJ and Dee were brilliant in doing, we must understand that there is nothing else that compares to chiropractic, and that our objective is simply the adjustment of vertebral subluxations for a fuller expression of innate law.
And you think Reggie came up with that in the 60s?
So who are you claiming came up with that? Not that it matters.
BJ came up with the whole idea.
Reggie took it further. BJ never left. I don't know if we're stuck on this. We're stuck on this, Doc. BJ never left.
Give me a minute. Give me a minute.
Take 10 minutes.
I tell you that I was checked regularly from the time I was born.
That's awesome.
Well, Reggie didn't come up with the idea.
No, not of that.
I was an intern. I forgot to mention I was an intern when Dr. Crowder's office for a year and a half. You're familiar with him, right?
I know Bud Crowder. I knew him. Yeah, I sure did.
Yeah. All right. So I spent a year and a half there. And he was still checking people that had been in the research clinic.
Yes, sir.
BJ's clinic. Well, they were kind of asymptomatic.
Good.
What do you mean good? I mean, that just disproves your whole idea.
No, it doesn't.
People were getting checked on a regular basis because BJ said that was a way to prevent or keep people healthy. Okay,
and now you just crossed the line into physical medicine.
Well, I'm just saying you're making a bullshit comment about physical medicine.
I'm not. You just crossed the line, Doc. When you said you're preventing something, and that, must be a Freudian slip because I don't see any banana peels. You just said that. That is the practice of physical medicine. We can't predict what's going to be prevented. You, me, or anybody.
Nobody can with any science. That's healthcare.
I'm okay with that. We'll keep the science to chiropractic since that's what we're talking about. But it's pretty simple. It's a pretty simple concept that when you start to say you're preventing something or getting sick people well, you're in the realm of physical medicine. No matter how often you get checked, it comes down, as you know, Joe Strauss, to your objective. What is your objective as a chiropractor? Reggie didn't come up with being checked on a regular basis. Certainly not. He came up with the objective as to why.
How does his why change?
I just explained it to you.
Excuse me?
The why.
Go ahead. Yeah, what's the why?
Because vertebral subluxations in and of themselves are detrimental to the expression of innate law. We cannot predict any physiological outcome, what you called nonsense. We cannot predict any physiological outcome. Logically, what we can say is every person lives closer to their full potential when vertebral subluxations are adjusted. And that's
Okay.
the truest thing we can say in chiropractic.
Explain to me how that happens.
Okay, be more specific in your question. What happens?
All right. Well, you said people are going to have a more full expression of life. What does
Okay.
that mean?
Well, that can be different for different people. We're looking logically through
No,
the
it should be
33
the same.
principles.
Logically, it should be the same thing.
Why? You're assuming that we know what innate normal is. No, it shouldn't be. It will never be the same thing. Maybe one person's liver functions better, heart beats better. Maybe they don't go through really bad things later on. We don't know. What we do know, however that manifests, is going to bring around a positive change in the physiology. We simply cannot predict how. It's pretty simple.
Yeah, but that's where it becomes nonsense. Because no matter what happens, you're going to claim, well, that's your normal.
Well, no, I would never say that. I would never say that. Our analysis, when the vertebral subluxation has been adjusted, better tell us that that vertebral subluxation is cleared. It better tell us that. And we know logically that person is stronger. We just simply don't know how. Neither do you, neither does anybody on the planet. So we've got to have this logic.
So if they start having more health concerns, more health problems, their health is degenerating.
Okay.
After you've adjusted them, you're going to say, well, that's your new normal. That's your optimal.
No, that's not what I'm going to say.
What
I'm going to say is this. Look, we can do everything we can here, and no matter what else you do, everybody needs vertebral subluxations adjusted. You could need to see other professionals in taking care of you. We don't deny medical service. We don't deny therapy. I think it's awesome. I go myself all the time. We're advocates for the habit of having vertebral subluxations adjusted, Doc. We're not sitting here saying this is the only thing you need.
I've been advocating that. I've been experiencing that.
Great, awesome. So let's let the whole world experience that.
But the question is, if somebody's not healthy, right? Do they need medical care?
Mm-hmm.
Or do they need a better chiropractor? Now, how do you determine that a person is clear, or his nervous system is clear? What are your tests?
We use advanced muscle palpation. Okay.
That's all you got.
So as far as a better chiropractor, and I don't know if you're trying to be insulting or not, but I'm going to assume you're sincere. I'm going to say this. I focused exclusively on chiropractic. Does that mean I accept everybody in my office? No. I want it to be a good fit. I want people to live local, that they can come by on a regular basis, Doc, because I truly care about the folks that I serve, and I want them to be able to come in on a regular basis. In the beginning, getting checked more frequently, but no less than a couple times a week throughout their life, okay? So as far as the analysis goes, this particular analysis that we use, if you want to know the logic behind it, when we look and we study the human body, there is a system for motion, and that's the muscular system. When a vertebral subluxation is present, the innate law would do everything it can to try to restore the vertebral subluxation back to its innate normal position. The vertebral subluxation itself is a limitation of matter. The system that's trying to do that is the muscular system around, the paraspinal muscles. Having a system that analyzes the muscles to figure out which muscles are working to try to make the adjustment happen gives us, one, the presence of a vertebral subluxation, and two, the vector in which the innate law is trying to make the adjustment. As the chiropractor, the best a chiropractor can do of any chiropractor on the planet is to be a part of the adjustment, you see. So when we understand, and every analysis has this in common, one, identifying the presence of a vertebral subluxation, and two, trying to figure out what the innate law is trying to do within the matter to restore that subluxated vertebra back to its innate normal position. That's every analysis on the planet. We simply use advanced muscle palpation to do so. So once we come up with, hold up, let me finish. So once we determine the presence of a vertebral subluxation, and then we determine the vector. We make a very gentle educator force in that direction with the intent that it's transitioned to an innate force so that it can return back to its innate normal position, and we post check it to see if the muscles are now balanced out.
So what's your definition of a subluxation?
A subluxation is the condition of a vertebra that's lost its proper juxtaposition with the one above, the one below, or both to an extent less than a luxation, which impinges nerves and interferes with the transmission of innate impulses, trophic impulses, and we'll leave it right there.
So you don't go along with the idea that a straightened cervical curve, for example, is a subluxation?
No, sir, that would be the practice of orthopedics. We do not know what innate normal is. No chiropractor knows innate normal.
And that's where it becomes nonsense.
What's that? That we don't know innate normal? I think it's nonsense to say you know innate normal. That's nonsense, Doc.
Well,
you know what's normal for me right now.
Here's where we become just a con job, right? Is when we can claim that, well, I can feel, based on my advanced muscle palpation, I can tell where subluxation is, and I can tell when it's gone. And the patient can't tell anything. You have no objective criteria. All it is based on what you feel. A second person can't come in and find the same thing. And then you want to tell the patient, well, whatever you're experiencing is what innate wants to happen for you.
I would never say that. I would never say that, ever. But go on.
Well, how are you going to interpret it?
It could be interpreted in many different ways. It can be interpreted many different ways. I don't know what innate normal is. So for you to say that everyone should have a straight spine or everyone's spine should look this way, that's total nonsense. And no matter what, as long as we have human beings and opinions involved, and we're working with an entity that we know very little about, which is the function of the human body, and life itself cannot be measured. And anybody who works with the body say we don't measure life, we try to observe it through what it does. And everybody knows that. So we do not.
Where does science enter the non-therapeutic chiropractic model?
Well, it enters it in chiropractic basic science to begin with, which is the 33 principles of chiropractic and the repeatability. Now, and here's, I'm sorry? That's
nonsense. Give me an experiment that you can conduct that would falsify any of those principles.
My goodness, it's a hard to vary argument that the universal principles, if you want to disagree with the universal principles, I mean, the 33 principles, fine. You disagree with the premise of chiropractic. I've got no problem with that.
What I'm saying is you have no science.
So it's a total, show me what science in the world, Doc, would argue a universal principle of organization in all matter, continually giving it its proper actions, thus maintaining it in existence. What science, what physics, what biology, what chemistry is going to argue with that? That's the basis of predictability.
We see that all the time.
I'm sorry?
We see falsification of that all the time in every diseased person. They're not.
Oh, no, wait, whoa. We're talking major premise. You're walking all the way down. Yes, of course we're going to see that in physiology because we don't know innate normal. And by golly, this is why we need logic. This is why we need to understand we're working with the metaphysical concept. No, hear me out because you're talking falsified science. I mean, yes, you can do double-blind studies. You can do intra and extra professional reliability with any technique, including AMP. And yes, there were things done at Pennsylvania State College, and Nick Spano's done things, and yes, and we continue to do things, and even Ron Castellucci, Dr. Castellucci has great research supporting the density of proprioceptive fibers in the zygapophyseal joints of the vertebrae, forming a reflex arc to the brain, back to the paraspinal muscles. And I'm not saying correlation is causation, but it makes a heck of an argument, Doc. So what we're saying is this. This is totally congruent because chiropractic acknowledges that there's a metaphysical and physical component, that we do not know innate normal. So like you're saying,
doesn't acknowledge okay, tell me what the metaphysical component is.
Universal and innate laws are totally metaphysical.
Okay, how is that metaphysical?
because it's
They were
beyond measurement. We
All
can't
right, give
prove
me
their
a minute.
existence
Give
beyond
me
their
a minute.
observation of what they do. We observe them by what they do. These are metaphysical concepts. This is basic chiropractic, doc. This is chiropractic 101.
Give me the
And
metaphysical part. You said it's a law like gravity, right?
yeah,
How does gravity work?
gravity is a pull
We
toward the
actually
center of
studied
the
it, right?
earth that we can demonstrate by what it does.
It's not even a
We
pull of
can
the earth.
demonstrate that there's a universal principle of organization by what it does. And that's one of the ways we can demonstrate it.
What happens when it's not working?
I'm not a physicist, so when it's not working, give me an example of what you mean, Doc, that it's not working.
If somebody's sick and they're not subluxated, then they're
Doc,
not
you
going
go
toward
from one
organization.
topic to another. You go from one topic to another. I'm talking. You're
Well,
talking
I'm sticking with
about
organization,
gravity.
and you're talking over me.
No. You're talking gravity, and then you're saying when it doesn't work. I'm thinking, when does gravity not work? But now you're talking about somebody
Well,
sick.
I switched back to chiropractic. I went back from
Then say that, please.
laws,
Then say
from
that. Let me know
laws.
when you do that.
Okay. We went from laws, scientific laws like gravity. You said this innate principle is like the law of gravity, right?
Okay.
All right. So when does the law of gravity fail?
When does the law of gravity fail? I don't know. Give me an example of it failing.
I don't know of any either. So let's look at then the organization principle. When people begin to become disorganized, why is that?
Okay. Well, it could be many reasons. And vertebral subluxation could be one of them. This matter, this living thing, is very limited. So this matter, we don't know what the innate normal is for this matter. And there's many things that could interfere with the function of this matter. Vertebral subluxations being one of many things.
So how do you establish for a patient that they have improved? All you've got is your advanced muscle palpation. Is that true?
Well, I wouldn't put it that way. That's the analysis that I utilize. And we look at it logically, that if a person's living, the longer, the more, the better, without vertebral subluxation, logically, they're living closer to their full potential, as in lieu of living with vertebral subluxations. As far as setting a baseline, which I believe is what you're talking about, now you stepped into the realm of physical medicine. We have to go back to the logic of the 33 principles. Do you want to live a life with vertebral subluxations, or do you want to live a life without them, or as often without them as possible? It's pretty black and white. But setting a baseline and saying that they've improved, we've now crossed into the medical model.
Then I disagree.
Okay, then we disagree on that, Doc.
Well, that is the chiropractic model. And what I'm saying is non-therapeutic chiropractic, the way you've taken it. Here's my disagreement. I practiced non-therapeutic chiropractic according to the Palmers.
They didn't practice in this model. They did not practice in this model. You could practice like the Palmers. That's getting sick people well. That is not this model.
You didn't listen to what I said.
Okay.
They practiced a non-therapeutic model.
I'm sorry, say that again?
The practice was non-therapeutic. And my premise is that non-therapeutic chiropractic gets therapeutic results. You're denying that.
I'm not denying that. I'm saying it can't be predicted. One, I'm denying that the Palmers practiced this way. They did not.
Well, they didn't practice with advanced muscle palpation, that's for sure.
That's fine. That's fine. As far as the technique, we can argue about that later. This is this DD's best work, the science, art, and philosophy of chiropractic?
I don't know if it's his best work, but it's one of them.
Okay, what's his best work?
I don't know what his best work is.
Okay, this book is, I'm enjoying this book, and there's a bit of conflicts in it, and I know him and BJ had their conflicts, but even in the opening statement, he's talking about treating disease. Granted, this is 1910, and he died in 1913, okay? And he's talking about the only system which adjusts the cause of disease, which there's no hyphen there. So the thing is that
I'm not disagreeing with that, but he says he's the one that started the idea that it's a non-therapeutic approach. What did he mean by that?
He meant that he was treating people for conditions and symptoms. He says it throughout the book.
What did he mean when he said it's a non-therapeutic approach?
He never said it's a non-therapeutic approach. He said it's a treatment for symptoms, conditions, and it is, let's see, BJ wrote his first book in 1906. It was always to get sick people well, Doc. It was always to get sick people well. The
Certainly,
Palmer
but
secret.
that's the point. The point I'm trying to make is the
Okay.
non-therapeutic chiropractic approach that you are advocating misses the whole point that the Palmers did, that non-therapeutic meant that we were adjusting subluxations and that sick people would get well because we adjusted subluxations. So it was the having, not tracing back from, although DD actually traced the symptom back to the spine, BJ got away from that, especially with upper cervical care.
In 1930, he did, but before that, he was doing it right. In 1930, he got away from that. And maybe 1924 when Dawson Evans created the NCM, the neurocolometer.
Yeah, so his whole clinic, the BJ's chiropractic clinic, was all about trying to come up with analysis to correct people, to correct subluxations, so that non-therapeutic chiropractic, just adjusting subluxations, would show that got sick people well.
That's not what non-therapeutic chiropractic is, Doc. And this is where we can close up here in a moment. You're confusing non-therapeutic chiropractic with the exclusivity of the adjustment of vertebral subluxations. That is not non-therapeutic chiropractic. Non-therapeutic chiropractic is the adjustment of vertebral subluxations because they in and of themselves are detrimental to the expression of innate law and for no other reason. Once you start getting sick people well, you are in the realm of physical medicine, totally different model, totally different profession.
And that's where we disagree, and that's where
we disagree. So this is actually,
because we actually focus on correcting subluxation, and if people aren't getting well, then my model is maybe I'm not getting the subluxation corrected. Your model is, well, you need
wait a second. Whoa. If first of all, you don't adjust a vertebral subluxation, but shouldn't your analysis tell you that a vertebral subluxation has been adjusted? Because you don't do that. You're trying to be a part of that. But when you say that, isn't your analysis telling you that this vertebral subluxation has been adjusted, doctor?
No, I agree with the idea that, as Stevenson pointed out, that we can have other than just a vertebral misalignment being a subluxation.
I don't know what that means. What does that mean?
Well, you can have structural distortions at the sacrum or at the cervicals, where you're getting stretches of the spinal cord, and that's not a vertebral level problem.
So I don't know where you're going with this. Are you saying that when a vertebral subluxation that is somebody in your office isn't adjusted, that's what's happening? I mean, what are you saying? In other words,
does your analysis people like you, and I don't want to pick. I don't want to say that.
You can pick all you want. Believe me, I'm fine, doctor.
No, I don't want to say that. I want to say that people go to other chiropractors and get well.
Okay, great. Awesome. I agree.
Yeah. And there can be a difference in analysis, and that difference in analysis makes a difference in their health outcome.
We have different outcomes that we're looking at. If in my analysis, the vertebral subluxation is not by post-analysis adjusted, then something's off.
Well, your assumption is that your analysis will detect any vertebral subluxation.
The analysis is that the vertebral subluxation is always bad, and the innate law is always going to try to restore it back to its innate normal position. That's not an analysis. That is congruent with deductive reasoning. That's where we're coming from. Going to another chiropractor and having better rapport, awesome. But the minute you start talking about results, that's getting sick people well, and that's out of the scope of practice that I have. I'm not trying to predict.
That's out of the scope of practice of the Mississippi law.
Now, the question is, what is arguable? if a chiropractor wants to practice within the law and minimize it to the analysis and the adjustment of vertebral subluxations and does so safely and not ever denying any medically necessary service, now we have arguability. And what it comes down with in state law, and every state is different in how they define chiropractic, which is imperative that every chiropractor define chiropractic in their office, determining the scope of practice. The state law's intent is for the safety of the public and the ethics of the chiropractor. And that is paramount. I do not want to practice. Do what?
Do you track a patient's symptoms?
We talk about them when they come in. And in that, and the first thing I will tell them that there are other professions you may need right now in regards to the treatment of these symptoms. I'm going to show you what we do here very safely in regards to the analysis and the adjustment of vertebral subluxations. And of course, I'm going to say this different when I'm talking to the people who come in. But I encourage professions who are in getting sick people well. I don't want to take any risks. You could need to see this medical doctor right now, and I encourage you to do so.
And you do track their symptoms.
Huh?
You do track their symptoms.
I talk about them when they come in, and I write them down if they have anything when they come in. But the first thing I do is immediately recommend the wonderful medical community or the physical therapy community or any of those other communities for the treatment of those symptoms and conditions. And we go over things. I'm not trying to deny anybody any service. My intent is to safely, gently, and specifically deliver the chiropractic service. And I want them to see other people because there's many things that can go wrong in the body. Vertebral subluxations is one of those things, Doc. And I just happen to be an expert in that category.
Well, you're an expert in AMP.
That's my analysis. Every chiropractor should be an expert in their analysis. Don't you agree?
Exactly. That doesn't mean your analysis is the only thing in chiropractic.
I've never said it was, Doc. I never said it was. But I will say this. Every chiropractor's analysis has to be able to be logically defended with conversations like this. I think what we're doing, yes, is very important for chiropractic. That's why we're doing this. And I think that both of us are passionate. And honestly, I mean, I've known you for quite a few years, and you've always been a classy guy. So I've always appreciated that. So thank you for that.
Well, I enjoy having a discussion like this as much as you do. And I think, and I agree with you, it needs to be done. But we need to find out where each other's at, right?
Yes, yes. 100%.
And my approach has been for 40 years that non-therapeutic chiropractic gets sick people well. Because therapy is not my focus. My focus is correcting vertebral subluxation. And if you go back to your, excuse me?
That's a conflict of statements. The minute you say NTC and then getting sick people well, there's totally different things, Doc.
Not if you look at the organizational principle. I've restored the organizational principle.
No, you didn't. And maybe you didn't do that. And second, that's innate normal. That's the best you can do is place an external invasionary force educatedly with the intent that it becomes an innate force. So the vertebrae can be restored to the innate normal position. You do not know what's going to happen physiologically.
Well, that's true of any science in healthcare. But just like any other science in healthcare, we can then monitor it, which is what you're doing. You're monitoring patient symptoms.
No, I'm not. I'm not. No.
You just told me you write them down on every visit.
If they tell me there's something going on, of course.
Well,
and then I analyze their spine. If they tell me something, and I'm always going to say, look, that can be a lot of different things. You may need to see a medical doctor immediately. We'll get you checked anywhere that's comfortable. And if it's not comfortable, that's what tomorrow's for. But we're not treating you for this symptom. We're simply...
Well, let me ask you. How much more time you got? Because I know we've gone beyond the time that you...
Yeah, we have. We're going to have to wrap it up here. I don't really... And I know you got up early for this, and I appreciate that because you're on West Coast time and I'm on Central time. So go ahead and ask me the one more thing, and then we'll wrap it up.
I have one more example. This is what I consider to be the non-therapeutic approach. My son, I'm not in practice anymore, but I do have a table. And my son went in, and this is therapeutic chiropractic, right? But a non-therapeutic approach. I just want to give an example. And this has been one of many, right? So his throat was hurting. And he told me that. And okay. So I'm not checking him. I'm retired, right? So he goes into ER and they tell him he's got a cyst in his throat. They can't do anything because they can't get to it. So the next day it's even worse. He goes back in, they drain it. And he says, they had a syringe this big around and they took about this much fluid out of it. And he still can't swallow. He's having trouble walking or talking. He can't move his jaw easily, right?
Yeah.
And finally I said, well, why don't we check you? And he said, well, it just makes sense that they took this out. You can look at my throat. It's all black and blue. And I said, well, I know that. I understand. Why don't we check it? I don't know if it'll help or not. Now, isn't that similar to what you would say? I don't know if it'll help or not.
That's pretty close, Doc.
Okay,
I would say this, though. I
put him on a table and I adjusted his subluxations. I didn't do it based on his symptoms. I did it based on my analysis. Okay. He got up off the table and he said, wow, I can move my jaw. My throat doesn't hurt. He was able to go home and eat for the first time in 2 days.
I love
it. Only lasted 3 hours, and I checked him again the next day. And I adjusted the subluxations. He didn't feel any better. I saw him that afternoon, and I checked him again. I adjusted a different subluxation, and he felt better. But it's all based on my analysis. It wasn't based on how he felt.
Yeah. Doc, you're so close. You're so close. The only thing I would say is a couple things to that, but because that's like you're a half a step away. I would say a couple things. One, just like you said earlier, keep checking them on a regular basis. And second, I would have said, look, this is going to help you. We just can't be specific in what physiological function. So let's get you checked and be checked on a regular basis. That's simple. That tiny step, boom. Now that's NTC completely. So yes, you are half a step.
I'm just saying you're half a step too far. And I told you in the beginning we were going to agree on most of this, right? And I'm just saying you're half a step too far. Because if I can prove to each patient, if every patient that comes in starts feeling better and it correlates with my analysis, then that has proven to the patient that we're actually doing something. And the model that you're suggesting has no way of disproving it or proving it. You're just saying, well, I've done this to my best of my ability, which is the same thing I'm doing. Only you're claiming mine is therapeutic, even though I'm checking them on a regular basis.
Because of your intent, not because of your sincerity. You don't know how they're going to feel. And if the objective is they feel better, then that now is a therapy. So I'm not questioning your sincerity.
We disagree right there, right? We disagree right there. Because the original idea, and like I said, I started doing this when I went through DD's book. And his original idea was, and then, as you said, B.J. Palmer furthered it. But the idea was to only adjust vertebral subluxations. But that by doing that, sick people would get well. And that's what I call it. And what I said for years, I've talked to, you'll enjoy this too, I think. I've written in newsletters that I'm a good for nothing chiropractor. I'm a good for nothing doctor, right? Because I'm not treating their symptoms. I agree with you. But I'm a kind of, at the same time, a good for everything. Because when people come in, they get well.
And then you were so good up until that last sentence. Maybe they get well.
But that's where the proof comes in.
No, it's not. It's not. The proof is in the analysis. Is the vertebral subluxation adjusted? Great. Then we know this person is living closer to their full potential. It's that simple. So you would say I take it too far. I'm saying you're not taking it far enough. And we, as gentlemen, disagree because I respect you for coming on and I respect you for sharing and articulating. And I want this to be a great example for the whole profession that right now you and I disagree and we're doing so with massive respect.
And we could do it again.
When we certainly will, Doc. So thank you for your time. I appreciate you very much and getting up early and giving this wonderful discussion. I'm going to share it. I'll tag you in it. You have a great day, brother.
Thanks, you too.
Thanks, buddy. Bye-bye.